This is Sound Health, the Lahey Health podcast, connecting people with content that helps improve their lives. Produced by Lahey Health.
Hello and welcome to Sound Health, episode 1 of Lahey Health's new podcast series, sharing the latest in innovative offerings from Lahey Health. I'm your host, Paul Joyle. We're really excited to launch this podcast series. We hope you become a regular listener and find it useful. On this inaugural edition of Sound Health, we'll be discussing the growth of a great program that integrates behavioral health into primary care offices to identify and treat mental disorders in patients. Do you have a primary care provider? You know, they really are the backbone of our healthcare delivery system. I think for most of us, they're the number one contact for preventative care and maintaining good health. Lahey Health has been the leader in the integration of behavioral health services into primary care practices. In fact, this collaborative care model is now in 11 Lahey Health primary care practice sites. It began a few years ago, but it is really growing. Dr. Patrick Aquino is Chair of Psychiatry and Behavioral Health for Lahey Hospital and Medical Center. We had a great conversation with him recently, and I asked him to tell us a little bit about the program, how it got started, how it works, and what was the motivation for putting it all together.
This program started as a pilot grant, a collaboration with Harvard Pilgrim Healthcare several years ago. And the basic tenets are establishing a behavioral health specialist in the primary care provider's office to support the primary care physician in their care of their patients that may have behavioral health needs. And we know from data across the country and across the Commonwealth that many of the patients that seek primary care have additional behavioral health needs, and a lot of these needs go unnoticed and untreated, and patients suffer from that. We also know that patients like to be seen by their primary care doctors. They prefer to be seen in that setting. So this is a way of really bringing them the care that they need and could benefit from in a setting that they're likely to receive it.
So talk a little bit more about the benefits of the program, what you see the benefits to the patient.
So I think the benefits are many. One is that they get to continue in a setting that they like and enjoy, that where they feel comfortable and have established relationships. We know that patients often, if they're referred out into the community or into specialty care, they're unable to find people who they take their insurance or have timely appointments. They don't know them. They have to go to far off places that they're unfamiliar with. So this is really keeping them in an environment where they are connected, and so they're more likely to return and stay in their care. The other is that we know when patients engage in this program that they're actually able to improve both in the behavioral health related conditions, but also in their medical conditions too. So we actually see patients' health and wellness improve over time, and actually in a faster manner than would be if these were treated independently.
Lisa Gellermini is a Lahey Health primary care behavioral health clinician based in Peabody, Massachusetts. She works every day in a primary care setting, and I talked to her to gain some additional perspective on how patients are benefiting.
First of all, just the location of the appointments. I think that's actually the biggest one, because I think that for a lot of people, there's a stigma of going to a mental health specific clinic. Here, they're just going to the same place where they see their primary care doctor. They know how to get there. They're comfortable. If they're talking to anyone else about it, they don't have to say, oh, I'm going to see my therapist. They say, I'm going to my primary care doctor's office. So yeah, it's just so much more comfortable for them. So I think that's a huge piece to removing the stigma. Not to mention they trust their primary care doctor. They're going to a person that their primary care doctor knows and works with, and therefore, in theory, trusts. So I think that makes it so much more comfortable and less stigmatizing for them. The other piece of it is that oftentimes, so a patient will meet with their primary care doctor. Their primary care doctor will assess some sort of issue, whether it's depression, anxiety, a substance use issue, really anything. And they'll come find me and I will come into the office and at least introduce myself. Again, I think that breaks down a barrier. So they know who they're going to be coming to meet with. They already kind of have an explanation of what my plan is when I meet with them. So I think it makes it a little bit less intimidating.
Primary care services are also crucially important for individuals with severe mental illnesses, whose physical health needs are often overlooked and who quite often have routine contact with mental health providers. Here's an amazing stat. Depression goes undetected in more than 50% of primary care patients. At Lahey Health, the primary care physician works hand in hand with the behavioral health clinician to provide personalized mental health services. Lisa spoke of one patient whose life was transformed from that early intervention and treatment and who's really showing positive signs of improvement.
One example of, again, a woman I just recently saw. When I first met with her, she was scoring pretty high on the depression scale as well as the anxiety scale. The way that she described it, it was really impacting her health because she had this apathy. She's like, I just don't care. I don't care about my health. I met with her and we did a lot of cognitive behavioral therapy just around the depression and trying to get her motivated to start to take care of herself better. She then started the antidepressant, and I was working with her PCP as well as the psychiatry department. And honestly, it totally changed her life. I mean, the other day she said to me, I can't believe that I feel as good as I feel right now. I never saw myself feeling this good. And not only is she feeling better emotionally, but I just see the way that she's taking greater care of herself. And I think that's going to have long-standing benefits for her.
Do you think that transformation obviously perhaps wouldn't have taken place if she didn't have the ability to connect with you via a primary care
Without
setting?
question, because it was the easiest way possible for her to see someone. If she was going to be seen in an outpatient setting, there would have been multiple barriers. First of all, she has transportation issues. Also, she knows her primary care doctor, so she felt comfortable going there. And my appointments was pretty quick and easy to get. So because there were so few barriers, she got there, even kind of against her will initially. And again, it changed her life.
Lahey Health is committed to providing much-needed mental health care, expanding the availability of behavioral services in the primary care setting, while offering care that is convenient for its patients. Do you have a roadmap in your mind as to a projection plan as to, okay, by the end of this calendar year, you want to be in so many sites? Do you think that way, or is it more just based on need?
Our plan really is to eventually get to all of our primary care practices. We feel this is a fundamental piece of the treatment of how we can take care of patients in the best way, in the right way, and give them the care that they need, where they need it, and when they need it.
Early diagnosis and treatment are critical, and with this program, patients can be screened during a visit to their primary care provider. If a need is flagged, the provider works with the clinician to evaluate the patient and determine how to manage his or her needs. This offers an efficient way of ensuring that people have access to mental health services.
Without screening, many of these patients will have conditions that will go unknown. They may not bring it up to their primary care doctor. Their primary care doctor may not know about it or understand it or hear about it. And so the first part of screening is really helping to identify a lot of these conditions. And we know through repeated studies of this particular intervention that patients improve. Their medical conditions and outcomes improve. Their behavioral health conditions and outcomes improve. They have less days lost from work, increased sense of satisfaction and wellness, overall are able to improve faster and achieve greater results.
One of the great things about this program is that patients have access to the full breadth of Lahey Health behavioral services, which has the largest array of community-based psychiatric services in this area. By the way, if you are looking for a primary care physician, visit laheyhealth.org/findadoc to locate one somewhere near you. We'd like to thank Dr. Patrick Aquino, Chair of Psychiatry and Behavioral Health for Lahey Hospital and Medical Center, for taking time to speak with us about this program, and Lisa Gellermini, Lahey Health Primary Care Behavioral Health Clinician, for sharing the patient perspective. Thank you for listening to episode number 1 of Sound Health. Look for new editions of our podcast located right here on Healthy State, and in the future on various podcast platforms. For Lahey Health, I'm Paul Joyle. Stay healthy.
Sound Health is a production of Lahey Health Marketing.